Welcome back to Pharmacy News. I'm delighted to be joined by Logan. Thank you so much for your time.
Thanks for having me.
Can we start by talking about atopic eczema and some of the impacts on sufferers?
Absolutely. The burden of disease is quite substantial in atopic eczema. First of all, they've got the cost of treating the problem. There's the patient's self-esteem, which can suffer as well. But the thing that pharmacies complain about most is sleep deprivation. And when the sufferer is a child, it can pervade the whole family and turn the day-to-day life into a nightmare.
What is some of the management for atopic eczema?
Management for atopic eczema, I guess you could break it into three things. There's pharmacological products, topical corticosteroids, and then there's non-pharmacological products. It's very important to use moisturisers at all times. And also there's lifestyle choices which needed to be added on in a holistic management of the problem.
What are some of the barriers a patient might encounter for management of eczema?
The biggest barrier of them all is unnecessary fears about the risks of topical corticosteroids. And where this is coming from varies. A lot of it's from Dr. Google and
Yes.
quite a bit of it's over the back fence. But also patients are being given false sense of risk from healthcare professionals as well. And it's important that we get on top of this because they don't use enough
Of
cream
course.
or they're haphazard in their application.
So how could a pharmacist and a GP for that matter reassure a patient?
I think in the benefits for the patient's adherence, it's really important that the GP puts concise directions on the prescription. And particularly if they've got prescribing software, they can switch on ERX or MediSecure, and those directions will be downloaded directly into the pharmacist's dispensing software. That makes a lot of sense to me. The other thing too is it would help if they put on the directions if they had a separate care plan involved, if they had directions to do that. From a pharmacist's point of view, pharmacists now need to realise that adding sparingly, a lot of the dispensing software in pharmacy prompts you to add sparingly to topical corticosteroids. That's entirely inappropriate. Our pharmacists have got to stop doing that.
Yes.
And also I think it's worthwhile, professional interaction at the pharmacy is very important. A pharmacist, if a script comes through with as directed on it, a pharmacist should take that opportunity to check if the patient actually has an action plan. And if they don't have an action plan, they should give them an action plan and suggest that they actually talk to their GP about filling it in.
The good news with atopic eczema is that there is light at the end of the tunnel.
There is light at the end of the tunnel. It's a treatable disease. It's a young person's disease, so quite often it resolves in mid-teens. If it's managed well, and again holistically, and I think it's about collaboration between all the healthcare professionals from the dermatologist down, it's very, very manageable and satisfying from a healthcare professional's point of view because you can absolutely add quality of life to not just the patient but the patient's family.
Logan, you're a very busy man. You need to go and catch a flight. I appreciate your time.
Thank you very much.
We'll be back with more pharmacy news shortly.